Nurse Aide State Exam. Let's get started. Which of the following methods is the correct way to remove a dirty isolation gown? Is it A, pull the gown over the head? Or B, let the gown drop to the floor and step out of the gown? Could it be C, roll the gown dirty side in and away from the body? Or lastly D, pull the gown off by the sleeve and shake the gown out? The correct answer is C. Here is why. This technique contains the contaminated outer surface within the gown as it is removed, preventing the spread of microorganisms. Pulling it over the head risks contaminating the hair and face. Letting it drop to the floor contaminates the floor. Shaking it out aerosolizes contaminants. Next question. The healthcare team member who assists the client with the performance of activities of daily living is it A, social worker? Or B, occupational therapist? Could it be C, speech therapist? Or lastly D, case manager? The correct answer is B. Here is why. Occupational therapists, OTs, are specifically trained to help clients regain or adapt their ability to perform ADLs like dressing, bathing, and eating. Social workers address psychosocial and discharge planning needs. Speech therapists focus on communication, cognition, and swallowing. Case managers coordinate care and resources. Next question. What does ambulate with assistance mean? Is it A, walk with the client twice a day? Or B, the client may use a wheelchair? Could it be C, have the client use a cane for walking? Or lastly D, the client can walk with the nurse aide providing help? The correct answer is D. Here is why. This is the direct definition of the term in a healthcare context. The client requires the physical support or supervision of staff to walk safely. It does not specify a frequency, twice a day. It indicates the client is walking, not using a wheelchair. Using a cane is one form of assistance, but the term is broader and includes support from a person. Next question. When transferring a client, most of the client's weight should be supported by the nurse aides. Is it A, back? Or B, shoulders? Could it be C, legs? Or lastly D, wrists? The correct answer is C. Here is why. Proper body mechanics dictate using the large, strong muscles of the legs to lift and pivot, protecting the weaker back muscles from strain. Using the back is incorrect and the leading cause of injury in healthcare workers. The shoulders are not the primary weight-bearing joints for lifting. The wrists are small joints not designed for bearing heavy loads. Next question. When changing a soiled dressing, the nurse aide should wash the nurse aide's hands. Is it A, before the procedure? Or B, after the procedure? Could it be C, before and after the procedure? Or lastly D, before, during, and after the procedure? The correct answer is C. Here is why. Hand hygiene before the procedure protects the client from introduced pathogens. Hand hygiene after the procedure protects the aide and prevents the spread of organisms from the soiled dressing to other surfaces. Washing only before leaves the aide contaminated after handling the soiled dressing. Washing during is typically not necessary unless hands become contaminated unexpectedly. Next question. The nurse aide must wear gloves when? Is it A, transferring a client? Or B, providing mouth care? Could it be C, dressing a client? Or lastly D, weighing a client? The correct answer is B. Here is why. Standard precautions require gloves when there is a reasonable anticipation of contact with blood, body fluids, secretions, excretions, or non-intact skin. During mouth care, contact with saliva, a body fluid, is certain. Transferring a client typically does not involve contact with body fluids unless the client is incontinent. Dressing a client usually does not involve contact with wounds or fluids. Weighing a client does not involve such contact. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.